everyone. Today I am doing a presentation on the doctors and tools during the French Enlightenment. So today I have Hermann Boerhaave, and he was alive between the years of 1668 and 1738. He was a Dutch botanist, chemist, and physician, and he was famous mainly in Europe. And he introduced the quantitative approach to medicine, and specifically, he was the first physician to implement thermometer measurements into practice. And he also demonstrated the relation of symptoms to lesions, and he first described Boerhaave syndrome, which is the tearing of the esophagus or throat, usually caused by intense strain or vomiting. In his book, Elementa Chemiae, first published in 1732, is recognized as the first text in chemistry, and it was used widely in the field at the time. Boerhaave stressed the importance of seeking fixed results firsthand instead of relying on the work of others. And this kind of thinking opened doors for other scientists, new experiments, and new reasoning that was present throughout the medical enlightenment in France. Next, we have Bernard Peyrille. He was alive between 1737 and 1804, and I could not find a photo of him. So, he was a French surgeon and oncologist. So he worked with cancer, and he was one of the founders of experimental research on cancer. And in 1773, he wrote the first systematic review of cancer, and this review was in the form of an essay, and it covered the symptoms of cancer, its growth, its treatment, and how a quote-unquote virus produced by a tumor caused wasting, which we now know as cachexia. And at the time, the word virus meant any substance that comes from a body and can transmit a disease. And cachexia is ongoing muscle loss that can't be entirely reversed with nutritional supplements or exercise. And he was still in school when he wrote this essay. And also in 1773, he was the first surgeon to treat a breast cancer by a radical mastectomy. And a radical mastectomy is a surgical procedure involving the removal of the breast's pectoral muscles and the axilla lymph nodes, which are in the armpit, of course. Is Johann Peter Frank. He was alive between 1745 and 1821, and as you can probably guess by the name, he was a German physician and hygienist. For much of his career, he worked on the Complete System of Medical Policy, which was a 9-volume treatise on all aspects of hygiene and public health. It included subjects such as public sanitation, water supply issues, sexual hygiene, maternal and child welfare, food safety, and prostitution. He stressed the importance of keeping accurate records and statistics for hospitals. His aim through medical policing work, public health work, and hygiene and health standards, his aim was to protect citizens from illnesses such as smallpox, syphilis, and typhus. He thought that the government should ensure clean water supply and educate the population about the importance of good hygiene. And also, Frank's system for record keeping was used by Ignaz Semmelweis, a Hungarian obstetrician, and he used it to show the correlation between puerperal sepsis, which is an infection of the female reproductive tract following childbirth or miscarriage, and he correlated that to unsanitary obstetrical practices in hospitals. Frank's policies also contributed to the development of veterinary schools and established the establishment of the Central Commission on Epidemics, which was later renamed the Royal Society of Medicine. And the Royal Society of Medicine collected information about epidemic diseases, physicians, and food resources. So it was very important to maintaining standards and making sure everyone had access to correct information, and everyone had the same information, which was very important. for establishing common medical practices. Lastly, we have Baron Dominique Jean Lery. He was alive between 1766 and 1842. He was a French surgeon in Napoleon's Grand Army, and he was considered to be the first modern military surgeon. He adapted flying artillery as flying ambulances for quick transport of the wounded on the battlefield, and he created the system of mobility and organization that is in field hospitals now. And it was eventually modified, for our modern tools and stuff, and became modern MASH units. MASH units are mobile army surgical hospitals, and they're fully functioning hospitals in combat areas. Modern units were established and given their names in 1945, just to give you an idea. And Larry also established a rule for triage of medical treatment. And triage is the prioritization of treatment in which the wounded are treated according to the seriousness of their injuries and the urgency for need of medical help. And this was done regardless of rank or nationality, which meaning allies, the French army, and enemies were all treated according to this procedure, and they were treated regardless of rank again. And this triage is a term and procedure used in field hospitals, and in regular hospitals it is used everywhere. It's really common. Now we're going to talk a little bit about medical tools, which I drew some for you guys. And first we have the stethoscope on top here, and it was invented in France in 1816 by René Laennec. It was made because it would be more comfortable and honestly less awkward to listen to a woman's heartbeat, and it's easier to hear a heavier set person's heartbeat. And as you can see, that left part, the insert, is where the doctor's ear would go, and then the other end would be on the patient's back or chest, of course. And on the bottom, we have a metal syringe, and these types of syringes were used to administer mercury to syphilis patients, because that was the treatment at the time for syphilis. Now, on the top left, we have two different types of scalpels used by surgeons in the 18th century, and they have wooden handles, of course, and then the top is metal because it has to cut skin, right? And on the right, there are skin retractors, two single ones of different sizes used by surgeons. These are called single ones, and then the one on the bottom is a double skin retractor. And skin retractors were used to separate the edges of a surgical incision or a wound, or to hold back underlying organs and tissues so that surgeons could see what they needed to see, inside the body. And all of these have wooden handles of different shapes, of course, because you need a different grip on a scalpel than you do on a retractor. Now, on the top left is a wrench for adjusting the blade in an amputation saw, and the handle on that is wooden as well. And in the top middle is a cautery for cauterizing wounds, which you burn the wound shut, and the handle on that is metal as well. And the top right is a bullet probe for finding lodged musket balls, and this whole thing is metal. And if you notice on the bottom of this, there is a hollow rectangle, and you can feel metal on metal, so that's how they would tell where the bullet is, because hitting bone and tissue with a metal probe feels different than hitting a musket ball. And on the bottom, there are two different tools. The top one is a pair of bullet forceps for retrieving lodged musket balls out of the body. And on the very bottom, we have a goat's foot elevator tooth extractor, which was used for removing canine teeth and incisors. So it wasn't a surgical tool necessarily, but it was a dental tool, which I thought was cool. It's called a goat's foot elevator tooth extractor. Finally, that is it. So thank you for watching my presentation, and I hope you learned something.